Welcome to Talking with Yourself, a podcast designed as a place to learn new things, talk about navigating the world, dealing with mental health, and just life in general. I'm your host, Sam Preston, and thank you so much for being here. Now, let's get into it. Hey everyone, happy Friday, and I hope you've been having a wonderful week. If not, then we'll take a big deep breath, we'll start over, and we'll make the next week better. For this episode, I am joined by a very lovely guest, Nichole. So Nichole, you are a registered therapist, correct?
That's right. I'm a registered psychotherapist in the province of Ontario and in PEI, actually.
Okay. So what exactly is a psychotherapist?
So a psychotherapist is someone who is qualified to do talk therapy. So our clients come in and meet with us or online, on the phone, doesn't matter how. And we discuss issues that may be bothering them, problems that they're having, different issues that arise for them. So someone might come in and present with anxiety, depression, I'm struggling with these different things. And then sometimes they pop in after we get to know each other and they might say, I had a fight with my spouse, I had a fight with my mother. And so we talk about the things that are in real time and then talk about the things that have also been bothering them through the past as well.
So there are different types of therapy that you can do. So you mentioned you mostly do talk therapy. What are some other types of therapy that you often get confused, like people often get confused with?
In psychotherapy, we're working with your mind and we're working with how the messages, our belief systems, things people have said to us, things we believe ourselves are affecting us every day, as well as diagnoses that may also be affecting us, right? So depression, anxiety, ADHD for some people, different things like obsessive thinking, intrusive thoughts. It just depends on each person has a sort of like different presentation of their needs. Some folks think that we are counselors, and that's not what we are, although we do counsel through therapy, but that's not the same thing. So in Ontario, in Canada, actually, the word counseling is not regulated. Okay. So almost anyone can put out a sign and say they're a counselor. They don't have to have specific qualifications to put that sign out. So life coaching is another word that is not controlled in Canada. So when you see someone who is a registered psychotherapist, it means they have to have gone through a battery of learning at the master's level and then also join the college of psychotherapists of the particular province that they're in. It's much more rigorous. The training is much more rigorous.
It's a very long process from what I've been told. Like approximately how many years of schooling and everything do you think it'd be?
It takes us, so you have to have an undergrad for sure, usually in social work, psychology, somewhere in that neighborhood. There are some exceptions to that, but that's a good general overview. Then you move on to the master's level. So the program that I took me 2 years of coursework, and that was 2 years like straight through, not school years, like we took them straight through, and then 8-month practicum that we had to do. So then there's standards we have to meet within our first couple of years out in the field as well. So it's very rigorous and we're very well supervised, very well observed, and the public is protected by the College of Psychotherapists to make sure we're doing our jobs well.
Yeah. And what about, because I know something that's kind of closely related to therapy is also social work as well. Mm-hmm. What is the difference between a psychotherapist and a social worker?
At the master's level, not much, except for where we belong to two different colleges. So at the undergrad level, social workers do a plethora of social support for different populations and different problems that people have. once you get to the master's level, someone who has a master's of social work can also do psychotherapy, but they are with the College of Social Workers. Okay. So the college's name is the College of Social Service Workers and Social Workers of Ontario. It's a big, long acronym. We, the therapists, we are with the College of Registered Psychotherapists. So it's the same amount of university, and the only real difference is our perspective, how we've been trained somewhat, and then also how the colleges hold us to certain standards after you graduate. There's some difference between the College of Social Workers and the College of Psychotherapists in our standards going into the practice. But other than that, we're both the same. Our approaches are just mildly different.
Okay. So in terms of like approaching, like coming up with approaches for clients and everything, do you often use things like CBT and?
Great question. That's a great question. So yes, we are trained in several different kinds of therapeutic interventions. So cognitive behavioral therapy is CBT. It is one of the most popular and well-known because it easily adapts for lots of different issues. And what we're doing is trying to make an intervention so someone's behavior can change because of how they cognitively think of something. Right? So it works really well in a lot of cases. There are other very good therapeutic interventions. So one called acceptance and commitment therapy is ACT. It's sort of like the grandchild of CBT. And I like it because it's a little bit more applicable in certain situations. So for instance, if I'm working with someone who has ADHD, that's one of my specialties. So I work with a lot of adults with ADHD. A lot of us don't enjoy doing homework, right? So trying to remember to do the homework before I come back to the session can become really, really stressful because we're busy trying to remember all the other things we're supposed to do. So ACT works better because there's a lot less homework. CBT often sends you home to observe your behavior, take records of the behavior that we're trying to target, and then you review those with your therapist. Excellent method, but not for everyone.
No.
Right? So if we stress somebody out, they're not going to come back to therapy.
Yeah.
Or they'll come in and say, I didn't do my homework, and they're feeling all kinds of shame, right? I don't want that. So I may switch to a different therapeutic intervention in that case. Family systems, internal family systems is another one that we use a lot. Attachment therapy talks about how you've attached to your primary caregivers or not early in life, and then that will then reflect into your adult relationships. So attachment therapy or attachment theory is very important as adults because we'll see these patterns reflected in our adult relationships that were actually caused in our childhood and how we attach to our primary caregivers. No one loves that thought because they think they got over it, right? Or they got through it, but it's actually true. It just depends. There are literally probably 10 or 15 I use, probably 10 I use on a regular basis that we're trained in. After we leave school, we can be trained at the professional level in different types of interventions and therapy. I do a lot of trauma work with people. So one of the interventions I use is called somatic therapy. So basically that means where in my body is my trauma trapped? And a lot of people think that's really, I don't know, spiritual or, it's not true. If anyone who has ever experienced some type of anxiety feels it in their gut, or they have, stomach issues, digestive issues, any of that kind of stuff, that's somatic, right? That's your body saying something's wrong down here.
Yeah, we often don't realize that a lot of our emotions affect our body and they show up in some form, like in one way or another.
Absolutely. I explain that like emotion, if you think about it like a ball of energy, okay? Yeah. So again, not spiritual, just physics, okay? If you think of it like a ball of energy, that emotion does not dissipate because we push it down. We become not consciously aware of it. We push it down so we can't see it or feel it,
Yeah.
but it is still alive. And the energy in it is still very much present. We just wish to not cognitively be aware of that, right? So that energy has to go somewhere. If you have not processed it well, it will land somewhere in the body and drive you crazy. So digestive issues is one of the biggest things I see with people with anxiety, headaches, body aches from depression. People don't know that if you're depressed for a period of time, your body will actually physically start to ache in different places. If you've experienced a trauma, then some people pull up into themselves to try to protect themselves. If you hear a loud noise, you pull yourself up to protect yourself. Okay. Almost like being scared. Someone jumps out behind, and scares you for fun. You pull up. Yeah.
Your instinct is to kind of coil in on yourself.
Coil in and jump up and jump away from them. The body experiencing trauma like that will hold that pulling up and protective mode. Okay? Because if you haven't processed the trauma related, your body's still pulled up. So I talked to somebody last week who came in and said, Nichole, my thighs are just killing me. What is the matter with me? And I said, so no weird exercises, going to the gym, went through a sort of normal things that would cause that to happen. No, she says. I said, you had a big meeting this weekend, or this week. You had a big meeting. You were really worried about that meeting at work. Yes. I said, is it possible you were holding all the muscles in your lower body pulled up to cope with the meeting, right? And she's like, oh my God, yeah. And so I did a little exercise with her to help her let go of that muscle tension that she was holding. I've seen people with pain in their chest, not like heart pain, but like muscle pain in the chest, back, headaches, neck ache, jaw ache, because we hold it all so tight, right?
Yeah. A lot of it isn't just holding it in your head and in your thoughts. It manifests in certain parts of your body that you don't realize until you're paying attention to it. And like you said, okay, I've been really stressed this week. Maybe I was holding that in my body and that's why I'm sore.
Absolutely. Yeah. All emotion is energy. If you just think of it like that, it's energy, and it either is dissipated appropriately or it gets stored.
Yeah, you can't just get rid of it.
It doesn't go away because you stop thinking about it.
Exactly.
Yeah.
It has to be released somewhere, and a lot of the time that's into your physical body.
That's right.
Yeah. And it's almost like people know that these are mental illnesses, and they hear the word mental and they go, okay, so everything's in the head. Everything has to be talked out and thought about, and they don't realize that, like being sick, there are side effects and there are certain symptoms that come along with them, and a lot of the time those come out in your physical body.
That's right. And a lot of us don't have to have a mental illness to start this process. We simply want to hide from the bad feeling.
Yes.
So we'll stuff it down. If it stays stuffed down long enough, or if this is how we cope with everything from our childhood, adolescence, and into adulthood, that's where we start to see the manifestation of something that we would call, a mental health issue or a mental health problem, right? Also depends on your genetics and predispositions and things like that. So if your parents are anxious, there's a really good chance you're going to be anxious.
Yes.
Right? There's predispositions like that. And so, if we don't cope, if we don't do something with it, it will manifest and it bothers us. And something I'll say to my clients often is, you don't have to feel as bad as you do today. It is unnecessary for you to continue in your life feeling as crappy as you do right now. Might not be able to take all of it away, but we can certainly relieve a whole bunch of how bad you feel right now, right?
Yeah.
Given some time.
Even just learning to properly go through your emotions is one of the biggest helps ever. And I think a lot of people don't realize that just knowing a healthy way to process your emotions makes all the difference.
Absolutely. And in each different case, we might need to learn new skills. So for instance, if you're pretty good at processing your emotions, but you suddenly experience grief for the first time in your life, you've lost a loved one for the first time in your life. And often young people, young adults in your age group, they may be experiencing deaths of their grandparents or of, close relatives for the first time. And learning to grieve, very different set of skills and emotions than, say, learning to cope with anxiety. Very different.
Yeah, we're all going through life for the first time, and you're bound to encounter new emotions that you haven't learned how to deal with.
Absolutely.
And so that's almost exactly why people come to you, is to learn how to deal with those emotions.
That's right. Yeah. To get some skills around that, to identify what the emotions are, because sometimes we're not aware.
Yeah,
Sometimes
oftentimes you're going through something and you don't even know what it is until you sit down and you talk to someone who's qualified to walk you through this.
That's right. I call it like kind of pulling apart the spaghetti on a plate. If you think about it, like it's all twisted up, and if we just take a minute and straighten it, there's a lot of stuff going on there, and you don't have to continue to feel that badly if you don't want to.
Now, you necessarily don't, and I think not a lot of people know this or think this way, but you don't necessarily have to be struggling to start therapy.
Oh, definitely not.
No.
Absolutely
Sometimes it's
not.
better to start it before you go through something.
I truly believe, and honestly, I mean, if I was a cardiologist, I would tell you have to take care of your heart, right? And that would be my bias.
Yes.
But I truly believe everyone should have a therapist. Therapists have therapists. We don't do our jobs without having a therapist to go to, because we take in so much of other people's emotions, feelings, traumas, issues, right?
Yes.
We have therapists, and we're taught through our education and also into our practicum and in through our supervision how to use self-care to be able to do this job, right? So we have to have therapists to do our job. So I think everybody should have a therapist. I think it's a lot like doing maintenance on your car.
Yes.
Right?
Yeah.
So if you don't change your oil once in a while, that car is not going to perform optimally. If you don't check on the tires, it's not going to perform optimally. You are going to pay either when you go to do a road trip, or you're going to pay when something breaks down. You'll get stuck somewhere because of a flat tire.
Yeah.
Right? That's very much like what you were saying. Maintenance of your mental health is the best thing you can do. And it allows you to build a relationship with your therapist so that when trouble hits or issues come up, you don't have to start bonding with somebody to trust them when you're in the middle of the storm.
Yeah, because that's the hardest thing, is you want somebody to help you through whatever you're going through at this moment. Mm-hmm. But at the same time, you're sitting down with somebody for the first time who you don't know one bit, and you're trying to build this relationship with them enough to trust them with what you're going through. Whereas if you have been seeing a therapist for months or years or however long, you already have this relationship with them.
Yeah.
So when unfortunately something does go downhill, they already know you. They know what your normal life looks like before something occurs.
Exactly. And you have that time to have built a rapport and know this person works in a way that works for me.
Yes.
And that's huge, because if you're in the middle of a problem and you're running around trying to try different therapists to figure out who's your jam, it's really tough. And I never expect anybody to walk in my office and immediately trust me, right?
Yeah.
But if you went to the emergency department with appendicitis, right? You lay on the stretcher for a long time. The nurses do the intake, all this kind of stuff. They may give you some painkiller if you're lucky. Anyway, eventually, a physician shows up at the end of the bed, right? You have 5 minutes to trust that person. And they're going to say to you, hey, your appendix needs to come out. We're going to send you upstairs. We're going to knock you out, get you naked, and cut you open. And you're going to go, okay, thanks. That'd be great, right? We do this intuitively. We trust the people who are at the end of the bed to do these things for us,
Yep.
right? You never ask to see your surgeon's credentials. You never go, I want to go to your office and see your certificates on the wall, or you're not cutting me open, right? Mm-hmm. You just take whoever is there in that storm.
And you often don't have time to, you spend 5 minutes with them and all of a sudden you're like, I don't like you. I want a different one.
Right.
In that moment, in that emergency, you don't have time to
Exactly.
pick and choose.
You need your appendix out.
Yep.
Right? The bedside manner does not matter.
No.
You need your appendix out. So with therapy, it's so very different, because the professional you need to bond to. You have to have time to be able to build a working relationship we call rapport, build rapport with that person, and trust. So then if you get some sort of mental health equivalent to appendicitis, then you can just come in and go, Nichole, I'm struggling with this week. What do you think this is about? And because we have a working relationship, we can nail it faster. We can figure it out together quicker, right? So you are in a position to be feeling better faster, but also to understand yourself, right?
Yes.
We have built some understanding of who you are, your personality, how your past experiences, your personality, different things like that create the person you are, right? So then when we go to look at this problem for you, going to be very different if 5 other people showed up with the exact same problem. But because we have a rapport built, I know how it's affecting you.
Yes. And with that level of trust, you're so much more likely to open up. If we're using the appendicitis example, if you're meeting this doctor for the very first time and you're in an emergency and you have to have your appendix out, but you don't really trust them, there's a good chance you're not going to be telling them everything if you don't fully trust them, which at the end of the day, like, it doesn't help you solve the core problem if you're leaving things out and if you're not fully trusting this person.
Exactly. That's exactly right. And I've seen cases where people don't heal as fast because they didn't trust their surgeon.
Yes.
Right? They physically manifest less healing quicker because they didn't trust. They're worried something went wrong. They're worried something happened or something's going to happen or they missed something or whatever. It depends on the surgery. It depends on the situation. But in that case that we're using, it's very intrusive, right? Like, they're asking you to be naked, knocked out, and now they're going to cut you, right? But we do this in our society all the time and don't even think about it. But we think working with a therapist is this really big, horrible, difficult thing to do, right? It's really not. I promise I will never ask you to get naked in a session ever, right? But emotionally allowing vulnerability is almost the equivalent, right?
Yes. Yeah. It takes a lot of strength and a lot of guts to open yourself up emotionally to somebody.
That's right.
And show them the deepest, darkest parts of you and say, this is who I am as I am. Please help me.
Right. And I scare myself. My darkness scares me.
Yes.
Right? Something's wrong with me. We all ultimately, I think, in our quiet thoughts, worry that we're too much, not enough, broken somehow, dark, messed up. I don't know. I've seen it all. But we're not. Those things are really normal. And lots of other people have had them. It's just you experience them by yourself and not ever having the ability to, like, open that up to, say, friends, family, because you're afraid of the rejection, which could happen. So that's, a safety thing. It's good. But you never have the ability for someone to say, no, this is okay. This happens. This is normal. This is, for what you went through, this is what's to be expected.
Yeah. As a society, I don't think we emphasize enough that, like, bad feelings are still a good thing. If nobody had bad days, it would make those happy moments mean so much less.
Yeah.
And I think it's almost like that with therapy as well, where immediately, or when you tell somebody you're seeing a therapist, they immediately go, well, what's wrong? What have you been doing? And I think therapist to some people is almost synonymous with a bad thing.
That's right.
When there could be nothing going wrong in your life. You could be the happiest you've ever been, and you could still be seeing a therapist, and that's totally okay.
Yeah, because you want to stay there.
Yeah.
Yeah, you want to stay in that happy spot. You want to be able to, as we grow as humans, we keep taking on more life goals, right?
Yes.
So that means our distress tolerance, our ability to cope with things that make us feel uncomfortable, has to also expand.
Yeah.
Right?
As you go through your life and you grow and you take on more things, you have to be able to take on more skills and more brain capacity to be dealing with that stuff.
That's right. And then, so distress tolerance is a CBT, DBT concept, dialectical behavioral therapy concept, but it's a brilliant concept because it applies to everyone. So we only have so much distress tolerance as a human, right? So something like university, we're actually paying the university to distress us,
Yep.
to expand our distress tolerance, right? We
Yeah.
actually pay them to do it to us. So first year is all about figuring out how to handle the workload, let alone do the work well,
Yeah.
right?
And it gets harder the
That's
further
right.
on into your schooling you go,
That's
the
right.
more work they throw at you.
That's right. So the distress tolerance, the ability for you to cope with more, must expand,
Yes.
right? So a lot of folks don't understand that this is true of our lives, right? So if you have a job, but you want to eventually you have an entry-level job and you want to become a manager, your distress tolerance has to expand. You have to learn how to handle more. So there's 100 examples of that. Becoming a parent, being in a relationship, living with somebody, there's all these things that make you expand your distress tolerance that we think is very normal as a society, right? So having a therapist on board helps you learn to manage that distress in a healthy way. So then you don't wind up with inappropriate coping mechanisms because the stress is too much. You have expanded how to cope at the same time your distress is expanding.
Yeah, and if you're not learning those healthy coping mechanisms, those feelings and emotions and everything often reveal themselves in unhealthy coping mechanisms.
Yes.
And if you're trying to deal with it and you don't have the skills, you don't even have the knowledge to know at the core what's going on, they're just going to keep building and building and building, and things are going to get worse and new problems are going to come on, and you're just going to overall struggle because you don't have that knowledge to be dealing with what you're going through.
Exactly. And a lot of folks think, I should just be able to do this. Well, that's not how this works,
No.
right? There's a lot of skills that you need to be able to cope with more distress. And a lot of folks think, if I just push it down, if I just make it stop, if I just get the pressure to stop, I'm actually getting better, I'm resting, right? And that's not true. No. So that's where we'll see, sort of like some substance use, or we'll see people, and there's nothing wrong. I'm not saying everyone's going to use substances, but that's where we'll see it jump on board often is, I'm going to use some cannabis on the weekend so that my brain will stop driving me crazy with all these thoughts and stress, right? And that's a thing, but eventually that can't be your only coping mechanism, right? Going out for drinks, sure, okay, no problem, have fun, but that can't be your coping mechanism. It will not help you in the future. So a lot of people believe that if they just shut the pressure off, that they're coping.
Yeah.
That's not true.
And if you, for example, like you'd go for a night out to be like, I need to take some stress off. And you're like, okay. But then it becomes a problem when you start chasing that feeling where you go, well, a couple of drinks of alcohol really took my mind off the stress. It made me feel less anxious. So every time I'm anxious, I'm just going to keep drinking.
That's right.
And then it becomes that problem.
That's right. Because it works and it's effective, right? It doesn't matter what our vice is or what our thing is, it will work, right? It could be food. It could be shutting our brain off, and, it's 1,000 different vices. That doesn't matter. But shutting your brain down like that and disassociating from reality is okay in small amounts, but it is not a problem solver.
Yes.
Okay. It's like a Band-Aid for the stress at that time, but it's not a problem solver.
It's like putting a Band-Aid on a gunshot wound.
Exactly.
It maybe it'll hold for like a tiny little while, but it's a big gaping wound. Eventually it's going to bleed right through that Band-Aid.
That's right.
And I know when I was like going through high school and university, I was having a lot of problems that deep down I channeled into an eating disorder because in my life, one of the only things I could control was my food and my food intake. And a lot of people thought, well, it's based on, like, she wants to lose weight. She wants to
has nothing to
do
do
this.
with it.
Exactly. And it was like, I had to come to terms with that too, that nothing I was going through actually had to do with food. Deep down, it was stress, it was anxiety, it was all these things that like I wasn't ready to deal with.
That's right. And so because your distress became overwhelming, you started to look for something you could control because it gave you the feeling that the distress wasn't as bad as it was.
Yeah.
Right? So as you begin to control something, that's a great example. Thank you for sharing that. As you begin to control something, you feel better momentarily. You feel better for a period of time, but the distress is still the amount of distress that you were going through, and you have not identified what is the distress, why is this happening to me, and what can I do to solve this that is healthy? Like, how do I diffuse this distress in a way that is going to be healthier in the future, right? Without having to hurt my physical being. And whether it's substances, and eating disorder, like almost all of the vices, if you look at them, I don't care if it's video games for hours and hours and hours, they will eventually physically affect you, right? They will affect you because you're not caring for yourself well, right? It doesn't matter what the vice is. And so, yeah, that's a great example. When we cannot control or deal with the amount of distress we're under, we will find some way to make ourselves feel better. That's basic human behavior.
Yes.
Right? But without the knowledge of how to do this well, that works for you. Yeah. Right? It has to be customized for you.
Yeah, therapy is not a certain approach is not a one answer for everybody.
That's right.
Therapy is essentially finding exactly what's going to work for a certain individual.
Exactly.
And exactly what's going to help them get through whatever may be going on.
That's exactly right. And some therapists use only, certain approaches, and that works really well for certain people, right? I take what we call an eclectic approach, which is I use any approach or a therapeutic intervention that I think will work for you. I don't care that it sits in a certain school of thought. So if you come to me and present, 5 people could present to me with anxiety, I'm going to customize how to treat their how to treat their anxiety 5 different ways.
Yeah.
It's not going to be the same way for everybody. There are some things that work for a lot of people, but there are some things that don't. So that's why people will say, oh, my best friend is my therapy. No, they're not skilled. They can listen, and when you get listened to, we all feel better.
Yes,
right?
But
because
they can't address. Yeah, they can't address the problem that's really at heart.
Right.
And that's why I think it's so important to find a therapist before things start going wrong, because maybe you do have a certain therapist that has an approach that you kind of already know in the back of your head isn't going to work for you, and that's totally okay, because therapy is all about finding what's going to work for you.
Yes.
So if you have that outlet before things start to go wrong, when you come to them, like we kind of talked about earlier, they already know you. You know their approaches, and like one of them will work for you.
Exactly.
And you work together because you work together so well because you know each other, that they're going to be able to say, okay, because I know you, here are a few approaches that I think will help.
Exactly. Yeah, the knowing you is going to change everything. And also, most therapists should or will approach you with, if this is not working between us, we've tried some stuff, it's not working, let me either try a different approach or find someone who I trust in the industry and refer you to them so you can get the help you need however you need it, right? We never hold our clients with like a grip. If I believe one of my colleagues in the industry is going to be a better fit for you, I'm going to send you to them, right? So I have a friend who specializes in death and bereavement and grief. I have a lot of experience in that, but she specializes. So if I find that one of my folks is struggling because we've sort of tapped out my education in an area or my experience in an area, I'm getting her on the phone and sending you over.
Yeah, it's why I think therapy is such a being a therapist is such a respectable career, because you're not in it for you. You're in it for that other person, and you do have that capacity to say, I'm not working out for you, let me guide you towards somebody who can better help you.
Exactly. And sometimes we send folks over permanently. Sometimes, if there's somebody with a specialty, we may send them over for whatever they decide, 5-6 sessions, and they'll send them back to you for their other stuff. There's lots of ways for us to work together for your best interest, right? And I mean, at the end of the day, the therapist has to cover their cost. The therapist has to cover, what it costs them to run the business and be available for you. And there's a lot more cost than people understand. Even just our licensing, our insurance, our rent, all of those sort of things have to be covered. And of course, most people know that in Canada, psychotherapy is not covered. So you need extended benefits at work, or you need to be able to afford to be able to see the therapist, right? And so in situations like that, we need to pay the bills, but I don't need to pay my bills so much that I'm not willing to get you the help you need.
Yeah, that's I think the tough part, and what stops a lot of people from seeking therapy is the cost.
Absolutely.
Especially if you don't have insurance, those bills add up really quickly. And I think that creates that barrier between people who they want help or they need help, but they can't afford it.
Exactly. Yeah.
And so segueing a little into that and just talking about the cost of therapy, you here you have a pay what you can program.
That's right.
And so that is run by 2 of your students, and it is to drop that financial barrier that stops a lot of people from seeking mental health support.
Exactly. So most therapists have their posted rate, and you can check that when you're looking for a therapist. You can go on Psychology Today or Google therapists in your area, and their posted rate will be on their profile. Okay. Then some therapists have what they call sliding scale, which means they will reduce their posted rate for you if you don't have benefits or the ability. That can sometimes still be really expensive.
Yes.
Right? So what we have done is, when I was in practicum, I had this idea introduced to me by my then supervisor, who is also a social worker. She was a master's of social work, and I used to be a social worker. So we, I think, look at the problems that people are facing or the barriers that people are facing, and our intuitive approach is, let's lower these barriers. How can we help more people? Right? That's almost always in the back of our mind. So mixing my social working with my therapy, this is what's come out. Okay. So I have 2 students, 3 right now, but 2 who are taking more clients, and they can offer a much more significantly reduced rate during their practicum. So they are supervised by psychotherapists who've been in the industry for years. They are able to see you in office. If you're here in the Hamilton area, they're able to see anyone in Ontario online. So literally anybody in Ontario can benefit from this program. So what we do is we ask folks, what do you think you can comfortably handle as, pay what you can, right? We are much more interested in folks being able to consistently handle the amount than to go, oh, well, you deserve more because I know the industry standard is higher, right? We don't want that. What can you afford and consistently be able to pay for your therapy? So we have a $25 minimum. So anyone in Ontario can have therapy for $25 an hour. It's excellent. And there's no cap. So if you see some of the programs sometimes that are like, yes, you can get free therapy, there's a cap on how many sessions you can have.
Yeah, it's kind of almost just like that little added, not sure the word I'm looking for is, but just that little added like piece where it's like, well, yeah, you can have this really reduced cost of therapy, and maybe I can afford 1 or 2 sessions, but if I'm entering into this practice, I have to, by their contract and their rule, I have to do 8 sessions, which you can't afford. And that, again, puts up that barrier.
Right. And also they can say, yeah, you can have 6 or 8 free sessions, but that means that the therapist working with you is under the stress of, we can only meet 8 times. And I've got to help you with this the problem you're having in 8 sessions. The first session is just intake. So that leaves us with 7, right? The last session is a wrap up. So that leaves us with 6. So I don't know a lot of problems. I mean, it will help, But I don't know a lot of problems that can be approached in 6 sessions and be done, like fixed.
Healing
right?
is usually almost always a very long process, and something that takes a lot of like mental and physical energy that you can't just be doing a session every day.
That's right.
It's going to burn you out. It's going to do more harm than good.
Yep.
And so therapy is something you need to do over a long period of time to get that desired effect.
If you can, for sure. And like I said, it will help. Short intervention, it's called solution focused therapy. Short intervention therapy will help you. It's better than nothing, right? It's way better than not having any help. But we ask for $25 per session, and you have no cap. You can see the therapist up to once a week, which is what we recommend for regularity and that kind of thing. If you can only afford every 2 weeks, that's fine. It's just going to take longer. But there is no cap on how many sessions you can have. So because you're participating in the fee, we can allow you to have 12 sessions. We can allow you to have whatever it takes, right? And so that gives you peace of mind. So if someone's experiencing anxiety and I tell them you can only have 8 sessions and the first and the last are probably not going to be much, so you get 6, it's just going to give them more anxiety. Like, what if we can't fix this problem in 6 sessions, right? And the therapist is also under some stress because we have to try to find a solution for the problem you're facing right now. So it reduces the ability to look at, well, where did this problem come from? Is this problem going to happen again in the future, right? We're solution focusing right here, right now, right? So our program is built so that there is no cap on sessions. So each of our students is here for 8 months. And at the end of those 8 months, if you wish, you can be transferred to another student who will be here for another 8 months. So you could literally, if you qualify, take therapy for the next 2 years, 3 years, whatever it takes, if you are willing to switch students every 8 months. And we can help you with that. We can make you very comfortable in that process. I know people get hung up on that, but it's really quite helpful. So we ask everyone to participate in the fee. One, because it makes you responsible for your sessions. It lets you feel like you're actually participating and doing something. And, you know, sometimes when we get a free service, we feel undeserving of it.
Yeah.
Right. So this takes all of that away, and then also allows us to cover some of the costs here so that you can continue to have therapy for as long as you need to have therapy.
And then you have that added bonus for your students as well, that they are getting lots of experience. They are getting lots of hours and practice in. And because that cost is so low and it opens it up to so many more people in such a big population that they might not have had access to had somebody been paying a full price for a therapy session.
Exactly. Yeah. So folks who have certain problems sometimes can't work while they have those problems, right? So now the folks, if they're off work, can afford therapy. So my students are seeing and working with those problems that they sometimes otherwise wouldn't. So it's a win-win for everybody all the way around. And like I said, the students are very supervised. They have 2 different supervisors, and we watch everything that they do and help them develop into the very best therapists they can be. And also, have you thought of this approach with this person? Have you thought of that approach with this person, right? And so you will get very good therapy, very good care. It doesn't matter that it's a student. In fact, I think in some ways it's even better because they're really paying attention.
And I think as a student, you haven't exactly found your exact calling. And so you're so much more open to learning new things and trying different approaches.
That's right.
And even then, as a student, maybe you get introduced to a certain approach or a certain type of therapy while you're doing this.
That's right.
That you kind of, it clicks in your brain that this is what I want to do. This is the exact type of thing that I want to go into.
That's right. I call it the therapeutic jam. So you finally find, this is my jam. This is my area. This is what I want to do. These are the folks I want to work with, right? So for me, when mine came together, they made no sense in some ways. It wasn't a traditional attachment of things. So I love working with adults with ADHD because it's very different than kids and adolescents with ADHD. and even folks that think they might have ADHD. I love that. I love working with trauma, right? How do these two things have anything in common? I don't know. Some folks with ADHD do suffer trauma, but some don't. And then I love working with anxiety and depression. So a lot of folks with ADHD have anxiety. People with trauma have anxiety, but to find my whole niche, my whole jam, sometimes they don't even make sense to connect to each other. And then in my work before I became a therapist, I worked with a lot of pregnancy related issues. So pregnancies that were unexpected, pregnancies that, were lost, any sort of, I call it reproductive story that you're going through, whether that's infertility or whether that's loss or whether that's, I wasn't prepared for this. How am I going to manage the distress tolerance expansion of what's happening? And I can see people through that as well. And certainly welcome anyone from the LGBTQ, so my area of jam looks very diverse, but it is often works really well. So the students are busy trying to find their jams and pull them together like that.
Yeah, and so with the amount of people coming in with this program, they're experiencing all sorts of different things. They're coming across things that may be their jam, that maybe they discover there's a sort of approach that they don't necessarily like, that they're not as in tune with, and then they come across another one that they go, yep, this is it. Yep. This is my jam. This is what I'm going to go into.
Exactly. I struggled with CBT when I was in school because I'm like, people are not going to do this homework. There's a certain personality group or two that will do the homework every time and it'll be perfect, right? Using CBT for those folks is amazing. But what about all these other folks, right? So I was like, CBT is not going to work for me all the time. I've got to figure out what else to do. And when I was in practicum, I found ACT. And so that's what my students are doing right now as well. But if you come in to see one of the students, rest assured, they are being very well supervised, very well helped, and they're very, what's the word? Gung-ho and want to help. So they're very motivated. They're very, very motivated right now.
And they're not uneducated. They've already gone through so much schooling to get here.
Oh, yes.
To become a therapist, and psychotherapist specifically, is such a long process. It's not like they walked in off the street and they went, I'm going to be a therapist. They put a lot of time, a lot of money, a lot of effort into this.
Absolutely.
So it's not like because you are getting this reduced pricing program, you're not getting good service. You are still getting good service.
Absolutely. And at a minimum, they've spent 6 years in university before they're even allowed to come to practicum. Often it's 7. So yes, you are absolutely, thanks for bringing that up. They're absolutely getting excellent, excellent care. And because they're interns has nothing to do with any impact to you as the consumer of the therapy at all. And like I said, they will make up for it in motivation, and you'll get very, very good care.
I think in a way you can look at it positively too, in the fact that they're interns, because they aren't getting paid for this. This is their practicum.
That's right.
So that they're not in it for the money. They're not in it because they're making, good bucks or whatever.
Oh yeah.
They're in it because they care about becoming a therapist and they care about this career path. So they're there because they genuinely care about their work.
That's right. There is a rule in psychotherapy and with the College of Psychotherapists, you are not allowed to be paid for a practicum. So in most cases, the interns are not being paid at all. And they're covering their tuition costs. They're covering a whole bunch of stuff. So they're paying to be here. So they're highly, highly motivated to help folks and to finally experience what they've been studying for so long. And the interns we currently have are lovely, both very motivated, gentle, sweet, approachable. One of them really wants to work with addiction issues in the future. The other one really wants to work with adolescents. We can take anyone over 14 and see them. So like 14 to 100 ages, no problem. There's no cap. And they will be very helpful for anyone who's struggling currently And like I said, definitely you do not have to feel as bad as you feel right now. There's lots of solutions.
Absolutely. There's so many options out there. And now with this program, it's open to so many different people, no matter your budget. If people do want to take advantage of your program, how do they apply?
Okay, so we have a few spots left. So I really want to encourage folks, if they think they want a spot, to get on board, because the students can only carry so many clients at one time. So what they would do is they would email me at Nichole, Nichole, at yellowchairtherapy.ca. Okay, so they just email me and say, hi, I'm Bob. I'm interested in the program that I heard on Sam's podcast, and then maybe give me an idea of the issues that you're hoping to work with. Okay, so let me be super clear at this point. The students cannot handle highly psychiatric issues. They're not psychiatrists. Okay, so we're handling, easier issues that lots of folks struggle with. Okay, but yeah, all you have to do is email me, Nichole, with an H in it, Nichole, at yellowchairtherapy.ca, and I will set you up with one of the therapists.
Yeah, I think it's important to remember that at the end of the day, they are still students, so they are still learning. They are not able to take on as much as a fully trained professional would be. Mm-hmm. So when you do go into these sessions, just to keep in mind that they are also still learning. I had mentioned at the beginning, are going through life for the first time or experiencing things for the first time. They are not going to be this registered, highly trained professional that you would usually go for paying that a big amount of money for.
That's right. And even normal psychotherapists that are well trained, we don't do highly psychiatric issues. Those we leave for the psychiatrists, because often folks need that level of care to manage those kinds of problems. Okay, so it doesn't mean if you have a diagnosis that we're going to panic, but I'm just letting people know that, if this is a issue you've been dealing with for years and years and years, and you have a psychiatrist on board or did to help you, then you may or may not qualify. But if I can, I'll point you in the right direction.
Yeah. So even, maybe if they accidentally send in a thing and realize they're not qualified, they at least have that outlet option. And even just a quick Google search of psychiatrists near me or psychiatrists online or anything like that. The internet is such a vast place that it's so easy to find a great amount of people.
Yeah.
And one of them is most likely the one for you.
Yep. Your family doctor can refer you to a psychiatrist so you don't have to pay.
Yep.
As well. And they will jump on and help out for sure. There's excellent programs in the city if that is what's going on for you.
Yeah. We are reaching our time limit here, so I do want to say thank you so much for all of this advice. This has been, even for myself, who I've been in and out of therapy before, and I do know some of the in and outs, this has been something that's been very eye-opening for me, and I've learned a good amount of stuff. So I really want to thank you for everything you've said. I normally do end off my podcast with an affirmation for the listeners, and I love getting my guests to do that if you do have an affirmation to send them off with.
Yeah. I don't want to be negative, so I kept trying to find a way to turn this positive, but you don't have to feel as bad as you feel right now. You just don't. There's so much help, right? So if you're struggling, you don't have to. You just don't have to. And mental health is so important for every other aspect of your life.
Yeah.
So find the help. Go for it. Find the help.
There's so many people in this world that there is a person out there for you. And sometimes the process is hard. It's long, it's difficult, and it's draining, but you will find that person out there for you.
Absolutely. No doubt in my mind.
Yeah, I absolutely agree. Well, thank you so much for having me. And I guess thank you so much for being here. And I really urge people to check out the program. And like you mentioned, there are a few more spots available. So please, if you are within kind of that budgeting and there is that barrier, use this to your advantage. Access it. apply, even just look into it. I think it's an amazing program. And again, thank you so much for joining me.
You're most welcome.
And to all the listeners, I will be talking to you next week. Bye now.